Question 1. Benchmark analysis indicates a significant increase in the cost of specialty pharmaceuticals within employer-sponsored health plans. As a global benefits manager operating under U.S. regulatory frameworks, which approach best mitigates the financial risk to the plan while ensuring continued access to medically necessary treatments for participants. Option A. Delegate full authority to the pharmacy benefit manager, PBM, to manage the specialty drug benefit, including all formulary decisions and negotiations, with minimal oversight from the benefits team. Option B. Increase the participants' out-of-pocket cost-sharing for all specialty pharmaceuticals by 50% without conducting a clinical impact study or assessing the financial burden on participants. Option C. Immediately remove all high-cost specialty drugs from the formulary to drastically reduce plan expenditures, relying solely on over-the-counter medications where possible. Option D. Implement a comprehensive review of the specialty drug formulary, focusing on clinical efficacy, therapeutic alternatives, and the potential for manufacturer rebates, while ensuring robust prior authorization and step therapy protocols are in place and subject to regular audit for compliance with ERISA and relevant state laws. The correct answer is D. Implement a comprehensive review of the specialty drug formulary, focusing on clinical efficacy, therapeutic alternatives, and the potential for manufacturer rebates, while ensuring robust prior authorization and step therapy protocols are in place and subject to regular audit for compliance with ERISA and relevant state laws. Explanation. This scenario is professionally challenging because it requires a benefits manager to balance cost containment with ensuring access to necessary medications for plan participants, all while adhering to specific regulatory requirements. The CEBS Global Benefits Management exam focuses on understanding and applying these frameworks in a practical context. The core of the challenge lies in navigating the complex landscape of pharmaceutical benefits, including formulary management, prior authorization, and step therapy, within the bounds of applicable laws and ethical considerations. The correct approach involves a comprehensive risk assessment that prioritizes patient well-being and regulatory compliance. This means thoroughly evaluating the potential impact of any proposed changes on access to essential medications, considering alternative treatments, and ensuring that all processes align with the principles of fairness and equity. Specifically, for a U.S.-regulated environment, this would involve understanding and adhering to the Employee Retirement Income Security Act (ERISA) and any relevant state mandates concerning prescription drug coverage. It also necessitates a deep understanding of the nuances of pharmacy benefit managers, PBM, and their contractual obligations, ensuring transparency and fiduciary duty to the plan sponsor and participants. The ethical imperative is to act in the best interest of the plan participants, which includes ensuring they can access medically necessary treatments without undue financial burden or administrative hurdles. An incorrect approach would be to solely focus on cost reduction without a thorough assessment of clinical impact or regulatory adherence. For instance, implementing broad, arbitrary exclusions of certain high-cost medications without considering clinical necessity or available alternatives could violate ERISA fiduciary duties and potentially lead to discrimination claims. Another incorrect approach would be to delegate all decision-making regarding formulary changes and utilization management to a PBM without adequate oversight or understanding of their methodologies. This abdication of responsibility fails to meet the fiduciary obligations of the plan sponsor and benefits manager, as it bypasses the required due diligence and could lead to practices that are not in the best interest of participants or that contravene regulatory intent. Furthermore, failing to establish clear, transparent, and appealable processes for prior authorization or step therapy can create significant barriers to care, which is ethically problematic and may also run afoul of specific state or federal consumer protection laws related to health insurance. The professional decision-making process for similar situations should involve a multifaceted approach. First, clearly define the objectives, which typically include cost management, quality of care, and participant satisfaction. Second, conduct a thorough risk assessment, identifying potential clinical, financial, and regulatory risks associated with any proposed changes. Third, engage with relevant stakeholders, including medical professionals, PBM, and legal counsel, to gather diverse perspectives and ensure compliance. Fourth, Develop clear policies and procedures that are transparent to participants and include robust appeal mechanisms. Finally, continuously monitor the effectiveness of implemented strategies and be prepared to make adjustments based on outcomes and evolving regulatory landscapes. Question 2. The performance metrics show a significant increase in employee turnover in a high cost of living location where the company provides housing allowances. Which of the following represents the most prudent and effective approach to address this situation? Option A. Conduct a thorough market analysis of housing costs and competitor benefit offerings in the affected location to inform a review of the current housing allowance policy. Option B. Immediately increase the housing allowance for all employees in that location to demonstrate the company's commitment to their well-being. Option C. Implement additional non-monetary benefits, such as team-building activities and professional development workshops, to improve employee morale and retention. Option D. Reduce the housing allowance to align with a tighter budget, assuming the current allowance is contributing to excessive operational costs. The correct answer is A. Conduct a thorough market analysis of housing costs and competitor benefit offerings in the affected location to inform a review of the current housing allowance policy. Explanation: the performance metrics show a significant increase in employee turnover in a high cost of living location where the company provides housing allowances. This scenario is professionally challenging because it requires balancing the company's financial objectives with the need to attract and retain talent in a competitive market. The effectiveness of the current housing allowance structure is directly questioned, necessitating a review of its adequacy and alignment with market realities and employee expectations. Careful judgment is required to ensure that any adjustments are both financially sustainable for the company and perceived as fair and competitive by employees, thereby mitigating retention risks. The correct approach involves conducting a comprehensive market analysis of housing costs and competitor offerings in the specific location. This analysis should inform a review of the existing housing allowance policy to determine if it adequately reflects current market conditions and provides a competitive benefit. The justification for this approach lies in its data-driven and strategic nature. It directly addresses the performance issue by seeking to understand the root cause, inadequate housing allowance, and proposing a solution grounded in external benchmarks and internal policy review. This aligns with the principles of responsible global benefits management, which emphasizes ensuring benefits are competitive, equitable, and support the organization's talent strategy. It also implicitly considers the need to comply with any local regulations regarding minimum housing standards or allowances. Although the CEBS exam focuses on general principles rather than specific country laws, an incorrect approach would be to immediately increase the housing allowance across the board without any supporting analysis. This is professionally unacceptable because it is a reactive and potentially wasteful expenditure. It fails to identify whether the current allowance is truly the sole driver of turnover or if other factors are at play. Ethically, it could lead to overpaying some employees while not adequately addressing the needs of others if the issue is more nuanced. Another incorrect approach would be to reduce the housing allowance to control costs, assuming the performance metrics are a sign of overspending. This is professionally unsound as it directly contradicts the observed increase in turnover, suggesting the allowance may be insufficient, not excessive. It ignores the potential negative impact on employee morale and retention, which could lead to higher recruitment and training costs in the long run, ultimately proving more expensive than an adequate allowance. This approach prioritizes short-term cost savings over long-term talent management and organizational stability. A third incorrect approach would be to focus solely on non-monetary benefits to address turnover, such as enhanced social events or training opportunities, while neglecting the housing allowance. While these benefits can contribute to employee satisfaction, they are unlikely to compensate for a significant shortfall in a fundamental cost of living component like housing, especially in high-cost areas. This approach fails to address the core issue indicated by the performance metrics and demonstrates a lack of understanding of the impact of essential benefits on employee retention. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the problem and its potential causes using available performance data. Second, gather relevant external data, market benchmarks, competitor analysis, and internal data, policy details, employee feedback. Third, evaluate potential solutions against organizational objectives financial constraints, and ethical considerations. Fourth, implement the chosen solution and establish mechanisms for ongoing monitoring and evaluation to ensure its effectiveness and make necessary adjustments. Question 3. What factors determine the most effective and compliant strategy for managing global employee benefits costs within the CEBS examination's regulatory framework? Option A. A strategy that prioritizes immediate cost reduction through benefit plan design changes, even if it leads to a perceived decrease in benefit value for employees, without extensive market comparison. Option B. Relying on the lowest cost vendor proposals without conducting thorough due diligence on their service capabilities and long-term financial stability. Option C. Implementing cost-saving measures based on general industry trends without specific analysis of the organization's unique employee demographics and benefit utilization patterns. Option D. A comprehensive approach that integrates data analytics, regular market benchmarking, proactive vendor management, and a focus on preventative health initiatives, all while ensuring strict adherence to relevant jurisdictional laws and ethical standards. The correct answer is D. A comprehensive approach that integrates data analytics, regular market benchmarking, proactive vendor management, and a focus on preventative health initiatives, all while ensuring strict adherence to relevant jurisdictional laws and ethical standards. Explanation. This scenario is professionally challenging because managing benefits costs effectively requires a delicate balance between controlling expenditure and ensuring the provision of competitive and valuable benefits that attract and retain talent. The CEBS Global Benefits Management Exam Jurisdiction focuses on a framework that emphasizes compliance, fiduciary duty, and strategic alignment with organizational objectives. Careful judgment is required to navigate the complexities of global benefit plan design, vendor management, and cost containment strategies while adhering to diverse regulatory landscapes and ethical considerations. The correct approach involves a comprehensive, data-driven strategy that prioritizes long-term sustainability and employee well-being within the established regulatory framework. This approach typically includes regular benchmarking against peer organizations, proactive engagement with vendors to negotiate favorable terms, and the implementation of wellness and preventative care programs to mitigate future cost increases. Ethically, this aligns with the fiduciary responsibility to manage plan assets prudently and to act in the best interest of both the organization and its plan participants. Regulatory compliance is paramount, ensuring all cost management strategies adhere to the specific laws and guidelines governing employee benefits in the relevant jurisdictions, such as those that might be tested in the CEBS examination. An incorrect approach that focuses solely on immediate cost reduction, without considering the impact on benefit quality or employee morale, would be professionally unacceptable. This could lead to a decline in employee satisfaction, increased turnover, and potential legal or regulatory challenges if benefit levels fall below legally mandated minimums or contractual obligations. Another incorrect approach that relies on anecdotal evidence or single-source vendor proposals without due diligence fails to meet the standard of care expected in benefits management. This can result in suboptimal pricing, inadequate service levels, and a failure to leverage the full potential of the benefits program. Furthermore, any approach that disregards the specific regulatory requirements of the operating jurisdictions, such as data privacy laws or non-discrimination rules, exposes the organization to significant legal and financial risks. Professionals should employ a decision-making framework that begins with a clear understanding of organizational goals and the competitive landscape. This should be followed by a thorough analysis of current benefit plan performance, including cost trends and utilization data, benchmarking against industry peers, and exploring various cost containment strategies, while always considering regulatory compliance and ethical implications, is crucial. Vendor negotiations should be robust and informed by market data. Finally, continuous monitoring and evaluation of implemented strategies are essential to ensure ongoing effectiveness and adaptability. Question 4. Examination of the data shows that a multinational corporation is implementing a new global claims processing and payment system. The IT department has developed a system designed for maximum efficiency and standardization across all regions. However, concerns have been raised by regional benefits managers regarding potential non-compliance with local regulations in several key operating countries, particularly concerning data privacy and dispute resolution processes. The project timeline is aggressive, and there is pressure to launch the system globally as soon as possible. Which of the following approaches best addresses the implementation challenge while adhering to regulatory and ethical obligations? Option A. Defer the global rollout and conduct an extensive, company-wide overhaul of all existing benefit plans to ensure they are harmonized with the new system's capabilities, regardless of local regulatory nuances. Option B. Implement the system in phases, with each phase requiring thorough review and validation by local legal and compliance experts in the target jurisdiction to ensure full adherence to all applicable national laws and regulations before proceeding to the next region. Option C. Proceed with the global rollout as planned, with the central IT team conducting a final review to ensure general alignment with international best practices and address any specific local issues that arise post-launch through ad hoc adjustments. Option D. Prioritize the launching countries with the most stringent regulations first, and then adapt the system for less regulated markets, assuming that compliance in one complex jurisdiction will cover most requirements elsewhere. The correct answer is C. Proceed with the global rollout as planned, with the central IT team conducting a final review to ensure general alignment with international best practices and address any specific local issues that arise post-launch through ad hoc adjustments. Explanation. This scenario presents a common implementation challenge in global benefits management, ensuring that a new claims processing and payment system aligns with the diverse regulatory requirements of multiple operating jurisdictions. The professional challenge lies in balancing the desire for a unified, efficient global system with the absolute necessity of adhering to local laws, which can vary significantly in areas like data privacy, consumer protection, and financial reporting. Failure to do so can result in severe penalties, reputational damage, and loss of trust from plan participants. The correct approach involves a phased implementation strategy that prioritizes thorough due diligence and local validation for each jurisdiction. This means engaging local legal and compliance experts to review and approve the system's design and functionality against specific national regulations before full rollout in that territory. This approach ensures that the system is not only technologically sound, but also legally compliant and ethically responsible in each market. It demonstrates a commitment to respecting local laws and protecting plan participants' rights, which is a core ethical and regulatory obligation in benefits management. An incorrect approach that bypasses local legal review and relies solely on a central IT team's interpretation of global standards is professionally unacceptable. This failure risks violating specific jurisdictional laws regarding data handling, e.g., GDPR-like principles in some regions, or different data localization requirements elsewhere, consumer rights in claims disputes, and reporting obligations to local authorities. Another incorrect approach, which assumes that a system compliant in one major jurisdiction will automatically be compliant in others, ignores the fundamental principle of jurisdictional specificity in law. This can lead to significant breaches of local regulations, as each country has its own unique legal framework governing insurance and benefits. A third incorrect approach, which prioritizes speed of implementation over comprehensive regulatory checks, directly contravenes the duty of care owed to plan participants and the employer, and exposes the organization to substantial legal and financial risks. Professionals should approach such implementation challenges by first establishing a clear understanding of the regulatory landscape in all relevant jurisdictions. This involves creating a detailed matrix of compliance requirements. The decision-making process should then involve a risk-based assessment, prioritizing jurisdictions with the most stringent or complex regulations. Collaboration with local legal counsel and compliance officers is paramount. A phased rollout, allowing for iterative testing and validation against local requirements, is a prudent strategy. This ensures that any identified compliance gaps can be addressed before widespread deployment, safeguarding both the organization and its plan participants. Question 5. When evaluating the Social Security implications for an employee temporarily seconded to work in a country with which their home country has a bilateral Social Security agreement, which approach best ensures compliance and protects the employee's benefit entitlements? Option A. Apply the Social Security rules of the host country without investigating if the bilateral agreement provides for an exemption or alternative arrangement for seconded employees. Option B. Assume the employee will remain covered by their home country's social security system and advise them to continue making contributions there, without verifying the specific terms of the bilateral agreement. Option C. Advise the employee to independently research and comply with the social security requirements of the host country, as the employer's responsibility ends with the assignment approval. Option D. Proactively identify the applicable social security legislation based on the bilateral agreement. Determine the employee's contribution and benefit rights under that legislation, and ensure compliance with all reporting and payment obligations. Correct answer is D. Proactively identify the applicable Social Security legislation based on the bilateral agreement, determine the employee's contribution and benefit rights under that legislation, and ensure compliance with all reporting and payment obligations. Explanation: this scenario presents a professional challenge due to the inherent complexity of cross-border Social Security coordination, particularly when an employee's benefit entitlements and contributions are affected by working in multiple jurisdictions. The CEBS Global Benefits Management exam focuses on understanding and navigating these intricate international frameworks. The core difficulty lies in ensuring compliance with diverse national social security systems while maintaining equitable and efficient benefit provision for mobile employees. Professionals must exercise careful judgment to avoid inadvertently creating gaps or overlaps in coverage, which can lead to financial penalties, employee dissatisfaction, and reputational damage for the employer. The correct approach involves a thorough assessment of the applicable bilateral or multilateral social security agreements between the employee's home country and the host country where they are temporarily working. This assessment should focus on identifying provisions that determine which country's social security legislation will apply to the individual, thereby dictating contribution obligations and eligibility for benefits such as retirement pensions, sickness benefits, and unemployment insurance. The regulatory justification stems from the principle of avoiding double Social Security contribution and ensuring that individuals do not lose their Social Security rights when moving between countries that have such agreements in place. Ethical considerations demand that employers act in good faith to protect their employees' Social Security interests. An incorrect approach would be to assume that the employee will automatically be covered by their home country's Social Security system, without verifying the existence and terms of any relevant international agreements. This failure to investigate the specific bilateral or multilateral arrangements can lead to non-compliance with the host country's mandatory Social Security laws, potentially resulting in penalties for both the employer and the employee, and leaving the employee without adequate coverage in the host country. Another incorrect approach is to solely rely on the employee's personal understanding of their Social Security obligations, as this abdicates the employer's responsibility to ensure proper administration of benefits and compliance with legal requirements. This overlooks the employer's duty of care and the legal framework governing employee benefits in both jurisdictions. A third incorrect approach is to apply the Social Security rules of the host country without considering any potential exemptions or special arrangements that might be available under international agreements, which could lead to unnecessary contributions or benefits being paid in the host country when they should be managed under the home country system. The professional decision-making process for similar situations should begin with a proactive identification of employees who will be undertaking cross-border assignments. This should be followed by a detailed review of the Social Security legislation in both the home and host countries, with a specific focus on any bilateral or multilateral Social Security agreements that may exist between them. Consultation with legal and benefits experts specializing in international Social Security law is crucial to accurately interpret these agreements and determine the applicable legislation. The employer must then implement a process to ensure compliance with the determined Social Security obligations, including appropriate registration, contribution payments, and communication with the employee regarding their rights and responsibilities. Question 6. The evaluation methodology shows a consistent approach to measuring the effectiveness of global benefits programs by focusing on a single, universally applied metric of employee participation rates across all operating countries. This metric is intended to gauge the perceived value of the benefits offered. Option A. relying solely on the percentage of employees who opt into each benefit, assuming that higher opt-in rates directly correlate with program effectiveness and employee well-being across all jurisdictions. Option B, prioritizing a reduction in the overall cost of benefits programs by identifying and eliminating underutilized offerings, regardless of their potential impact on employee morale or legal requirements. Option C, assessing employee satisfaction through surveys and focus groups, alongside utilization data and cost-benefit analysis, while ensuring compliance with local data privacy laws and benefit mandates in each country. Option D, implementing a standardized global survey that measures employee perception of benefits value, without considering regional differences in cultural expectations or specific legal requirements for employee benefits. The correct answer is C, assessing employee satisfaction through surveys and focus groups, alongside utilization data and cost-benefit analysis, while ensuring compliance with local data privacy laws and benefit mandates in each country. Explanation: this scenario presents a professional challenge because measuring the effectiveness of global benefits programs requires a nuanced understanding of diverse employee needs, cultural contexts, and the specific regulatory environments of each operating country. Simply applying a single, standardized metric across all regions risks misinterpreting data, leading to ineffective program adjustments, and potentially violating local compliance requirements. Careful judgment is required to select evaluation methods that are both globally consistent in principle and locally relevant in application. The correct approach involves a multifaceted evaluation that combines quantitative data on program utilization and cost with qualitative feedback on employee satisfaction and perceived value, all while ensuring alignment with the specific legal and regulatory frameworks governing benefits in each jurisdiction. This approach is professionally sound because it provides a holistic view of program impact, allowing for data-driven decisions that enhance employee well-being and organizational objectives. Ethically and regulatorily, it respects the diverse legal landscapes by ensuring that any evaluation and subsequent program changes are compliant with local laws, such as data privacy regulations, e.g. GDPR if applicable to the jurisdiction, and specific benefit mandates. An approach that focuses solely on cost reduction metrics is professionally unacceptable because it ignores the primary purpose of benefits programs to support employee well-being and attract/retain talent. This can lead to the elimination of valuable benefits, negatively impacting morale and potentially creating compliance issues if essential benefits mandated by local law are removed. An approach that relies exclusively on global averages without considering regional variations fails to acknowledge the diverse needs and expectations of employees in different countries, leading to potentially irrelevant or even detrimental program changes and overlooking localized regulatory nuances. An approach that prioritizes employee self-reporting without independent verification or objective data can be misleading, as employee perceptions may not always align with actual program effectiveness or cost implications, and could also inadvertently lead to noncompliance if subjective feedback leads to decisions that contravene specific benefit regulations. Professionals should adopt a decision-making framework that begins with clearly defining the objectives of the benefits program in each jurisdiction. This should be followed by identifying key performance indicators, KPI, that are relevant to these objectives and measurable across different regions, while also accounting for local regulatory requirements. Data collection methods should be chosen for their ability to capture both quantitative and qualitative insights and to ensure compliance with local data protection laws. Finally, analysis should involve comparing results against benchmarks and objectives, considering regional differences, and using the insights to make informed, compliant, and ethically sound adjustments to the benefits programs. Question 7. Cost-benefit analysis shows that implementing a standardized, centralized global benefits governance framework could significantly reduce administrative overhead and streamline policy management. However, this approach might overlook specific local regulatory nuances and employee protection laws in various countries where the company operates. Considering the absolute priority of regulatory compliance in global benefits management, which approach best aligns with the principles emphasized in the CEBS Global Benefits Management exam? Option A. Prioritize the development of a comprehensive global benefits governance framework that includes robust mechanisms for continuous monitoring of local regulatory changes and ensures adherence to all applicable laws and employee protection standards in each jurisdiction. Option B. Focus on a global benefits governance framework that prioritizes employee satisfaction and perceived fairness, with compliance being a secondary consideration, addressed only when mandated by significant legal challenges. Option C. Adopt a decentralized approach where each country's benefits program is managed independently, relying solely on local expertise to ensure compliance, thereby avoiding the complexities of a unified global framework. Option D. Implement the standardized, centralized global benefits governance framework immediately to realize cost savings, assuming that local legal counsel will address any specific compliance issues as they arise. The correct answer is A. Prioritize the development of a comprehensive global benefits governance framework that includes robust mechanisms for continuous monitoring of local regulatory changes and ensures adherence to all applicable laws and employee protection standards in each jurisdiction. Explanation: this scenario is professionally challenging because it requires balancing the perceived cost savings of a streamlined global benefits governance framework against the critical need for robust compliance with diverse and evolving international regulations. The CEBS Global Benefits Management exam emphasizes the importance of understanding and adhering to these frameworks to protect both the employer and its employees. A decision-making process that prioritizes regulatory adherence over potential cost efficiencies is paramount. The correct approach involves establishing a comprehensive global benefits governance framework that explicitly incorporates mechanisms for ongoing monitoring and adaptation to local regulatory changes. This is right because it directly addresses the core principles of global benefits management, ensuring compliance, mitigating risk, and providing equitable benefits. Specifically, it aligns with the CEBS curriculum's focus on understanding the legal and regulatory landscape of different countries, the importance of due diligence, and the need for proactive risk management in international employee benefits. Ethical considerations also demand that employees receive benefits in accordance with the laws of their respective jurisdictions, safeguarding their rights and well-being. An incorrect approach that focuses solely on cost reduction without adequate regulatory due diligence fails to meet the fundamental compliance requirements. This could lead to significant penalties, legal disputes, reputational damage, and potential harm to employees who may not be receiving legally mandated benefits. Another incorrect approach that relies on a single, standardized global policy without considering local variations ignores the diversity of legal and cultural contexts, creating a high risk of non-compliance and employee dissatisfaction. A third incorrect approach that delegates compliance responsibility entirely to local entities without a centralized oversight mechanism creates a fragmented and potentially ineffective governance structure, increasing the likelihood of oversight failures and inconsistent application of compliance standards. Professionals should employ a decision-making framework that begins with a thorough understanding of the regulatory requirements in each operating jurisdiction. This should be followed by an assessment of the risks associated with non-compliance, and then the development of governance structures and processes that demonstrably mitigate these risks. The framework should include regular audits, clear lines of accountability, and a mechanism for updating policies and procedures as regulations change. Prioritizing compliance and employee welfare, even if it incurs higher initial costs, is essential for sustainable and ethical global benefits management. Question 8. Regulatory review indicates that a multinational organization operating under the Global Benefits Management exam, CEBS, jurisdiction is experiencing challenges in employee engagement with its global benefits program. Employees in different regions express varying expectations regarding the types and levels of benefits offered, leading to concerns about program effectiveness and potential compliance gaps. The organization needs to assess the risks associated with these cultural differences in benefit expectations. Which of the following approaches best addresses the risk assessment requirements for this scenario? Option A. Implement a standardized global benefits package designed based on the cultural norms of the parent company's home country to ensure consistency and administrative efficiency across all operations. Option B. Prioritize the selection of the most cost-effective benefits globally, regardless of regional cultural expectations or specific regulatory nuances within the CEBS framework, to maximize financial savings. Option C. Delegate the entire responsibility for benefit design and risk assessment to local HR departments in each operating region without establishing a unified global oversight mechanism. Option D. Conduct a comprehensive risk assessment that analyzes how cultural differences in benefit expectations might impact program utilization and compliance with CEBS principles, and identify specific areas where benefit design may need to be adapted to meet diverse employee needs while remaining compliant. The correct answer is D. Conduct a comprehensive risk assessment that analyzes how cultural differences in benefit expectations might impact program utilization and compliance with CEBS principles, and identify specific areas where benefit design may need to be adapted to meet diverse employee needs while remaining compliant. Explanation: this scenario is professionally challenging because it requires a global benefits manager to navigate significant cultural differences in employee expectations regarding benefits, while simultaneously adhering to the specific regulatory framework of the Global Benefits Management Exam (CEBS) jurisdiction. The CEBS framework, while not tied to a single nation, emphasizes principles of fairness, compliance, and responsible plan design that must be applied universally. The core challenge lies in balancing universal best practices with localized cultural norms and legal requirements, ensuring that benefit offerings are both compliant and perceived as valuable by diverse employee populations. Careful judgment is required to avoid imposing a single cultural perspective on benefit design, which could lead to non-compliance, employee dissatisfaction, or unintended adverse selection. The correct approach involves conducting a thorough risk assessment that explicitly considers how cultural differences might impact the perceived value and utilization of benefits, and how these differences interact with the regulatory requirements of the CEBS jurisdiction. This means identifying potential areas where benefit expectations diverge significantly across cultures, e.g., attitudes towards retirement savings, health and wellness programs, family support benefits, and evaluating the regulatory implications of tailoring benefits to meet these expectations. For instance, if a culture highly values extended parental leave, the risk assessment must consider the legal framework governing such provisions within the CEBS scope and the financial implications for the employer. This approach ensures that benefit strategies are not only compliant with overarching CEBS principles, but also culturally sensitive and strategically sound, mitigating risks of non-compliance, employee disengagement, and operational inefficiencies. An incorrect approach would be to assume that a standardized global benefits package, designed based on the cultural norms of the majority workforce or the home country of the parent company, will be universally accepted or compliant. This fails to acknowledge the diversity of employee expectations and the potential for regulatory noncompliance in different operating regions. It also ignores the ethical imperative to provide benefits that are relevant and valued by all employees. Another incorrect approach is to prioritize cost savings above all else, leading to the selection of benefits that are cheapest to administer but do not align with cultural expectations or regulatory mandates. This can result in low employee uptake, increased turnover, and potential legal challenges if the chosen benefits are deemed inadequate or discriminatory under local interpretations of CEBS principles. A third incorrect approach is to delegate benefit design entirely to local HR teams without a robust global oversight framework. While local expertise is crucial, this can lead to fragmented and inconsistent benefit programs that may not adhere to the overarching compliance and ethical standards expected within the CEBS framework, potentially creating compliance gaps and administrative complexities. The professional decision-making process for similar situations should involve a structured risk assessment framework that integrates cultural intelligence with regulatory compliance. This framework should include steps for identifying cultural nuances in benefit expectations, assessing their alignment with CEBS regulatory principles, evaluating potential compliance risks, and developing culturally sensitive and compliant benefit solutions. Continuous monitoring and feedback mechanisms are essential to adapt benefit strategies as cultural expectations and regulatory landscapes evolve. Question 9. Risk assessment procedures indicate that the organization is considering a significant overhaul of its employee benefits package to enhance its competitiveness in the market. The proposed changes include introducing a new health insurance plan with a higher deductible but lower monthly premiums, expanding the retirement savings match, and offering a more generous parental leave policy. The HR department has gathered competitor data and is eager to implement these changes quickly to attract top talent. Which of the following approaches best aligns with responsible global benefits management principles in this scenario? Option A. Focus primarily on cost-saving measures by selecting the lowest cost-benefit options available, even if they offer less comprehensive coverage or may not fully meet the diverse needs of the current employee base. Option B. Implement the benefits that receive the most positive anecdotal feedback from a select group of employees, without a systematic review of the broader workforce's needs or the legal implications of the proposed changes. Option C. Conduct a thorough analysis of the proposed benefits against the organization's strategic objectives, employee demographics, and the relevant regulatory framework, with a specific focus on potential discriminatory impacts and fiduciary responsibilities before implementation. Option D. Prioritize the implementation of the benefits that appear most attractive to potential new hires based on competitor benchmarking, assuming that market competitiveness automatically ensures compliance and suitability for the existing workforce. The correct answer is C. Conduct a thorough analysis of the proposed benefits against the organization's strategic objectives, employee demographics, and the relevant regulatory framework, with a specific focus on potential discriminatory impacts and fiduciary responsibilities before implementation. Explanation: this scenario is professionally challenging because designing competitive benefits packages requires a delicate balance between attracting and retaining talent, managing costs, and adhering to the specific regulatory landscape of the Global Benefits Management Exam (CEBS) jurisdiction. The CEBS exam focuses on a broad understanding of global benefits, but for the purpose of this question, we will assume a hypothetical jurisdiction that emphasizes employer fiduciary duty and non-discrimination principles in benefits design, mirroring common global regulatory themes without referencing specific country laws. The core challenge lies in ensuring that the proposed benefits, while competitive, do not inadvertently create discriminatory outcomes or expose the employer to undue legal or financial risk due to a lack of due diligence. Careful judgment is required to navigate these complexities and ensure the package aligns with both strategic business objectives and legal/ethical obligations. The correct approach involves a comprehensive review of the proposed benefits against the employer's strategic objectives, employee demographics, and the prevailing regulatory environment, with a specific focus on potential discriminatory impacts and fiduciary responsibilities. This approach is professionally sound because it prioritizes a holistic and compliant strategy. By considering the employer's goals, the workforce's needs, and the legal framework, the employer can design a package that is both attractive and legally defensible. This proactive assessment helps mitigate risks associated with non-compliance, such as penalties, litigation, and reputational damage. It also ensures that the benefits serve their intended purpose of supporting employee well-being and engagement without creating unintended adverse effects. An incorrect approach that focuses solely on benchmarking against competitors without considering internal employee needs or the regulatory implications would be professionally unacceptable. This failure stems from a lack of due diligence regarding the employer's specific context and legal obligations. It risks adopting benefits that may not be suitable for the existing workforce or could inadvertently violate non-discrimination rules if the competitor's workforce demographics differ significantly. Another incorrect approach that prioritizes cost reduction above all else, even if it means offering less comprehensive or potentially less equitable benefits, is also professionally unsound. This approach neglects the employer's fiduciary duty to provide benefits that are reasonably suited to the workforce, and the potential for such cost-cutting measures to lead to discriminatory outcomes or fail to meet employee needs, thereby undermining the purpose of a benefits package. A third incorrect approach that involves implementing benefits based on anecdotal employee feedback without a structured analysis of the overall workforce needs or regulatory compliance would be professionally deficient. While employee feedback is valuable, relying solely on it without a broader, systematic assessment can lead to a fragmented and potentially non-compliant benefits program that does not serve the organization's strategic goals or all employee segments equitably. The professional decision-making process for similar situations should involve a structured framework. 1. Define strategic objectives. Clearly articulate what the benefits package is intended to achieve for the organization. G. Talent attraction, retention, employee well-being. 2. Analyze workforce demographics and needs. Understand the characteristics, needs, and preferences of the current and target employee population. 3. Conduct regulatory and legal review. Thoroughly assess all applicable laws and regulations, paying close attention to non-discrimination provisions and employer responsibilities. 4. Benchmark competitively and responsibly. Research competitor offerings. Critically evaluate their suitability and compliance within the employer's specific context. 5. Assess financial implications and sustainability. Evaluate the costs associated with proposed benefits and ensure long-term affordability. 6. Design and implement with due diligence. Develop the package, ensuring it meets strategic objectives, employee needs, and regulatory requirements, with a clear plan for communication and administration. 7. Monitor and evaluate. Regularly review the effectiveness and compliance of the benefits package and make adjustments as needed. Question 10. The efficiency study reveals that the current preventive care and wellness program is underutilized, leading to suboptimal health outcomes for employees and increased long-term healthcare costs for the organization. Which of the following strategies would be the most effective and compliant approach to address this issue? Option A. Conduct a thorough assessment of employee needs and preferences, review communication strategies for clarity and accessibility, and explore partnerships with external providers to enhance program offerings and engagement. Option B. Implement a mandatory participation requirement for all employees in specific wellness activities, with penalties for non-compliance. Option C. Immediately reduce the budget allocated to the wellness program and focus resources on reactive healthcare interventions rather than preventive measures. Option D. Increase the collection of employee health data through the wellness program without explicitly informing employees about the purpose and scope of data usage. The correct answer is A. Conduct a thorough assessment of employee needs and preferences, review communication strategies for clarity and accessibility, and explore partnerships with external providers to enhance program offerings and engagement. Explanation. The efficiency study reveals that the current preventive care and wellness program is underutilized, leading to suboptimal health outcomes for employees and increased long-term healthcare costs for the organization. This scenario is professionally challenging because it requires balancing the organization's financial interests with its ethical responsibility to employee well-being, all while adhering to the specific regulatory framework governing employee benefits in the relevant jurisdiction. A careful judgment is needed to identify strategies that are both effective in promoting employee health and compliant with all applicable laws and guidelines. The correct approach involves a comprehensive review of the program's design, delivery, and communication strategies, with a focus on identifying barriers to participation and implementing targeted improvements. This includes ensuring that the program's offerings are relevant to the employee population's needs, that communication is clear, accessible, and culturally sensitive, and that the program is integrated with other employee support services. This approach is considered best professional practice because it directly addresses the root causes of underutilization and aims to create a sustainable, impactful wellness initiative. From a regulatory and ethical standpoint, this proactive and employee-centric strategy aligns with the principles of responsible benefits management, which prioritize employee health and safety and aim to foster a healthy work environment. It also ensures that the organization is meeting its obligations to provide beneficial programs without creating undue burdens or discriminatory practices. An incorrect approach would be to simply reduce the scope or budget of the wellness program without understanding the reasons for its underutilization. This would be a failure to uphold the ethical duty to support employee well-being and could lead to a decline in employee health, potentially increasing future costs. Furthermore, such a decision might be seen as a disregard for the initial investment in employee health and could negatively impact employee morale and engagement. Another incorrect approach would be to implement a wellness program that relies heavily on data collection without robust privacy safeguards or clear consent mechanisms. This would violate data protection regulations and ethical principles concerning employee privacy, potentially leading to legal repercussions and a loss of trust. A third incorrect approach would be to mandate participation in certain wellness activities without considering individual circumstances or offering reasonable alternatives. This could be discriminatory and may not align with the spirit of promoting voluntary engagement in health-promoting behaviors. Professionals should adopt a decision-making framework that begins with a thorough assessment of the current situation, including data analysis on program utilization and employee feedback. This should be followed by a review of best practices and relevant regulatory requirements. Solutions should then be developed collaboratively, involving stakeholders from HR, benefits, and potentially employee representatives. Finally, any implemented changes should be monitored and evaluated for effectiveness and compliance. Question 11. The efficiency study reveals that while many multinational corporations are seeking to harmonize their global benefit strategies, the diverse nature of Social Security models worldwide presents a significant challenge in achieving consistent and equitable employee welfare programs. Which of the following analytical approaches best addresses this challenge for a global benefits manager? Option A. Prioritizing the analysis of the generosity of statutory benefits provided by each country's social security system to identify the most comprehensive state-provided coverage. Option B. Recommending that employers focus on providing robust private benefits to supplement or replace social security provisions, regardless of the strength of the national system. Option C. Focusing on the funding mechanisms and underlying principles of each social security model to understand its sustainability and the extent of state versus individual responsibility. Option D. Assuming that all social security systems operate on a pay-as-you-go basis and comparing the contribution rates to employer-sponsored pension plans. The correct answer is A. Prioritizing the analysis of the generosity of statutory benefits provided by each country's social security system to identify the most comprehensive state-provided coverage. Explanation. This scenario is professionally challenging because it requires a nuanced understanding of how different social security models are designed and funded, and how these designs impact their sustainability and the benefits provided. A global benefits manager must be able to critically evaluate these models to advise employers on international benefit strategies, ensuring compliance and effectiveness across diverse regulatory environments. Careful judgment is required to avoid oversimplification and to recognize the complex interplay of economic, social, and political factors that shape each model. The correct approach involves recognizing that social security systems are not monolithic and vary significantly in their underlying principles, such as the degree of state provision versus individual responsibility, and their funding mechanisms, e.g., pay-as-you-go versus funded. A comprehensive understanding of these variations is crucial for accurate comparative analysis. This approach is professionally sound because it aligns with the CEBS exam's focus on a global perspective of benefits management, emphasizing the need to analyze and understand diverse regulatory frameworks and their practical implications for employee benefits. It allows for informed decision-making regarding international benefit design and administration, ensuring that strategies are tailored to the specific social security landscape of each relevant jurisdiction. An incorrect approach that focuses solely on the generosity of benefits without considering the funding sustainability of the underlying social security model is professionally unacceptable. This fails to acknowledge the economic realities and long-term viability of such systems, potentially leading to recommendations that are unsustainable or that misrepresent the true cost and commitment involved. Another incorrect approach that assumes all social security systems operate on a pay-as-you-go basis ignores the existence of funded or hybrid models, leading to inaccurate comparisons and potentially flawed strategic advice. Furthermore, an approach that prioritizes employer-sponsored benefits as a complete replacement for Social Security, without understanding the mandatory nature and scope of state provisions in many jurisdictions, demonstrates a fundamental misunderstanding of global Social Security frameworks and could lead to non-compliance and inadequate employee coverage. Professionals should approach this by first identifying the core objectives and operational principles of each Social Security model under consideration. This involves researching the funding mechanisms, eligibility criteria, benefit structures, and the balance between state and individual contributions. Subsequently, they should conduct a comparative analysis, highlighting similarities and differences in how these models address key social risks, e.g., retirement, unemployment, disability. This analytical framework allows for the identification of potential gaps or overlaps with employer-sponsored benefits and informs strategic decisions that are both compliant and effective within the specific global context. Question 12. Research into the design and implementation of a global wellness program for a multinational corporation reveals varying legal requirements across its operating countries. Which of the following approaches best ensures regulatory compliance and ethical program delivery? Option A. Prioritize cost-effectiveness by offering a basic, universally applicable wellness offering that minimizes legal review in individual countries. Option B. Conduct a comprehensive legal and regulatory review for each country of operation to identify specific compliance obligations before program design and implementation. Option C. Apply the wellness program regulations of the company's headquarters country to all global operations, assuming a standardized approach is sufficient. Option D. Implement a globally standardized wellness program based on general industry best practices, without specific country-by-country legal research. The correct answer is B. Conduct a comprehensive legal and regulatory review for each country of operation to identify specific compliance obligations for program design and implementation. Explanation: this scenario presents a professional challenge because designing and implementing global wellness programs requires navigating a complex web of diverse legal requirements and cultural expectations across multiple jurisdictions. Failure to adhere to these specific regulations can lead to significant legal penalties, reputational damage, and a breakdown in employee trust. Careful judgment is required to ensure that the program is not only effective in promoting employee well-being, but also compliant with all applicable laws. The correct approach involves a thorough understanding of the specific regulatory frameworks governing employee benefits and health programs in each target country. This includes identifying any mandatory reporting requirements, data privacy laws, such as GDPR if applicable to the jurisdiction, and any specific provisions related to health and wellness initiatives. By prioritizing compliance with these distinct legal obligations, the organization demonstrates a commitment to responsible global operations and protects itself from legal repercussions. This approach ensures that the program is legally sound and ethically implemented, respecting the rights and privacy of employees in each region. An incorrect approach that focuses solely on a single jurisdiction's regulations and attempts to apply them universally fails to acknowledge the sovereignty and distinct legal landscapes of other countries. This can lead to violations of local laws regarding data protection, employee rights, or even the definition of what constitutes a permissible wellness benefit. Another incorrect approach that disregards any specific legal requirements and relies only on general best practices for wellness programs is equally problematic. While best practices are valuable, they do not supersede mandatory legal obligations. Failing to identify and comply with these specific laws can result in significant penalties and legal challenges. A third incorrect approach that prioritizes cost-effectiveness above all else, potentially by offering a standardized, minimal program across all regions without considering local legal nuances, risks overlooking critical compliance issues and may not be culturally appropriate or effective for employees in different locations. Professionals should employ a decision-making framework that begins with a comprehensive legal and regulatory audit for each country where the program will be implemented. This audit should identify all relevant laws and guidelines pertaining to employee benefits, health, and data privacy. Following this, a risk assessment should be conducted to understand the potential consequences of noncompliance. The program design should then be developed iteratively, ensuring that each component meets the specific legal requirements of the relevant jurisdiction, while also aligning with the overall wellness objectives and cultural sensitivities. Continuous monitoring and periodic reviews of the program's compliance with evolving regulations are also crucial. Question 13. To address the challenge of ensuring consistent and compliant employee benefits across diverse international operations, a global benefits manager is considering a new global life insurance policy. Which of the following approaches best ensures adherence to varying legal and regulatory frameworks across countries? Option A. Conducting a detailed, country-specific legal and regulatory impact assessment for the proposed life insurance policy in each operating country before implementation. Option B. Adopting a standardized global benefits package that prioritizes administrative ease and cost-effectiveness with minimal country-specific adjustments. Option C. Relying on the advice of the insurance provider to ensure compliance, as they are experts in global insurance offerings. Option D. Implementing the life insurance policy based on the legal and regulatory requirements of the company's headquarters country, assuming these are the most stringent and will therefore cover other jurisdictions. The correct answer is D. Implementing the life insurance policy based on the legal and regulatory requirements of the company's headquarters country, assuming these are the most stringent and will therefore cover other jurisdictions. Explanation: this scenario is professionally challenging because a global benefits manager must navigate a complex web of differing legal and regulatory frameworks when designing and administering employee benefits programs across multiple countries. The core difficulty lies in ensuring compliance with each jurisdiction's specific requirements, which can vary significantly in areas such as mandatory benefits, data privacy, reporting obligations, and employee rights. Failure to do so can lead to severe penalties, legal disputes, reputational damage, and employee dissatisfaction. Careful judgment is required to balance global consistency with local adaptation. The correct approach involves conducting a thorough, country-specific legal and regulatory impact assessment for each proposed benefit change. This means systematically identifying all relevant laws, regulations, and guidelines in each operating country that pertain to the benefit in question. For example, if a company is considering introducing a new health insurance plan, the assessment would need to consider local mandates on coverage, provider networks, contribution rules, and any specific reporting requirements to local authorities. This approach ensures that all legal obligations are met before implementation, minimizing risk and ensuring the benefit is legally sound in every jurisdiction. This aligns with the ethical duty of care to employees and the legal obligation to operate within the bounds of the law in each country. An incorrect approach would be to assume that a benefit program that is compliant in one country can be rolled out universally without further review. This fails to acknowledge the fundamental principle that laws are jurisdiction-specific. For instance, implementing a retirement savings plan designed for the U.S. Employee Retirement Income Security Act, ERISA, in Germany, without considering the German occupational pension scheme, betriebliche Altersvorsorge regulations, would likely result in non-compliance, as the German system has distinct funding, vesting, and governance requirements. Another incorrect approach is to rely solely on the advice of local HR managers without verifying the legal basis of their recommendations. While local HR managers have valuable insights, they may not always be fully abreast of the latest legal nuances or may interpret regulations differently. This can lead to overlooking critical legal requirements, such as specific data protection laws, e.g., GDPR in Europe, that dictate how employee benefit data can be collected, stored, and processed across borders. A third incorrect approach is to prioritize cost savings or administrative simplicity over legal compliance. While efficiency is important, it should never come at the expense of adhering to the law. For example, attempting to use a single, simplified disclosure document for all countries, regardless of local statutory requirements for specific benefit information, would be a clear violation of legal disclosure mandates in many jurisdictions. The professional reasoning process for similar situations should involve a structured, risk-based approach. First, identify the proposed benefit change and the countries in which it will be implemented. Second, engage legal counsel or compliance experts in each relevant jurisdiction to understand the specific legal and regulatory landscape. Third, conduct a detailed impact assessment, documenting all compliance requirements and potential risks. Fourth, develop an implementation plan that explicitly addresses how each compliance requirement will be met. Finally, establish ongoing monitoring mechanisms to ensure continued compliance as laws and regulations evolve. Question 14. Analysis of a multinational corporation's benefit strategy reveals a new initiative to significantly reduce healthcare expenditure by consolidating providers and increasing employee co-payments. What is the most appropriate approach for the benefits manager to assess the potential impact of this initiative on employee access to healthcare and the quality of care received, considering the global regulatory framework and ethical obligations? Option A. Focus primarily on negotiating lower rates with the consolidated providers to ensure the cost-saving targets are met. Option B. Conduct a comprehensive risk assessment to identify potential barriers to access and quality degradation across all employee groups and regions, and develop proactive mitigation strategies. Option C. Rely on employee feedback and complaints to identify any issues with access or quality after the new plan is implemented. Option D. Prioritize the selection of providers based solely on their willingness to offer the lowest service costs. Correct answer is B. Conduct a comprehensive risk assessment to identify potential barriers to access and quality degradation across all employee groups and regions, and develop proactive mitigation strategies. Explanation: this scenario presents a professional challenge because it requires a benefits manager to balance the employer's desire to control costs with the ethical and regulatory imperative to provide access to quality healthcare for employees. The CEBS exam emphasizes understanding the regulatory landscape and ethical considerations in global benefits management. The core tension lies in ensuring that cost containment measures do not inadvertently lead to a reduction in the quality of care or create barriers to accessing necessary medical services, which could have legal and reputational consequences. The correct approach involves a comprehensive risk assessment that proactively identifies potential gaps in healthcare access and quality stemming from benefit design. This approach is ethically sound and aligns with regulatory expectations that employers have a duty of care towards their employees. Specifically, in many jurisdictions, there are implied or explicit requirements to provide benefits that are reasonably adequate and do not discriminate unfairly. A thorough risk assessment allows for the identification of high-risk employee groups or service areas where access or quality might be compromised, enabling proactive mitigation strategies. This aligns with principles of good governance and responsible benefit provision, aiming to prevent adverse health outcomes and employee dissatisfaction. An incorrect approach that focuses solely on cost reduction without considering the impact on access and quality is professionally unacceptable. This failure stems from a narrow interpretation of the employer's obligations, potentially violating regulations that mandate a certain standard of care or access to essential services. For instance, if a cost-saving measure involves restricting access to specialist care without providing adequate alternatives, it could lead to delayed diagnosis and treatment, potentially breaching employment law or specific health insurance regulations, depending on the jurisdiction. Another incorrect approach that relies on anecdotal evidence or employee complaints without a systematic review is also flawed. While employee feedback is valuable, it is not a substitute for a structured risk assessment. Relying solely on complaints might mean that significant issues affecting a larger, less vocal group of employees are overlooked. This reactive stance fails to meet the proactive duty of care expected of benefit managers and could lead to systemic problems that are more difficult and costly to rectify later. The professional decision-making process for similar situations should involve a multifaceted approach. First, clearly define the objectives of the benefits program, including cost efficiency, employee well-being, and compliance. Second, conduct a thorough risk assessment that considers potential impacts on access and quality across different employee demographics and geographical locations. Third, engage with healthcare providers and insurers to understand service availability and quality metrics. Fourth, develop mitigation strategies that address identified risks, prioritizing employee health and safety. Finally, establish a system for ongoing monitoring and evaluation to ensure the benefits program remains effective and compliant. Question 15. The investigation demonstrates that a multinational corporation is experiencing challenges in ensuring consistent compliance of its international employee healthcare benefits programs across its operations in the United States, Germany, and Japan. The company has a global benefits policy, but local legal counsel has raised concerns about potential discrepancies. The global benefits manager needs to conduct a risk assessment to identify and address these compliance gaps. Which of the following approaches represents the most robust and professionally sound method for this risk assessment? Option A. Assume that the healthcare regulatory framework in the United States, being a major market, provides a sufficient baseline for compliance in other developed nations like Germany and Japan. Option B. Rely on the existing global benefits policy as the primary compliance standard, assuming that adherence to this overarching policy will satisfy the majority of local regulatory requirements. Option C. Prioritize a cost-benefit analysis of the current international healthcare benefits to identify areas for potential savings, with regulatory compliance being a secondary consideration if significant cost deviations are found. Option D. Conduct a comprehensive, country-by-country analysis of all applicable healthcare regulations and compliance requirements in the United States, Germany, and Japan, mapping these against the company's existing global benefits policy and local benefit provisions. The correct answer is D. Conduct a comprehensive, country-by-country analysis of all applicable healthcare regulations and compliance requirements in the United States, Germany, and Japan, mapping these against the company's existing global benefits policy and local benefit provisions. Explanation: this scenario is professionally challenging because it requires a global benefits manager to navigate the complexities of differing national healthcare regulations and compliance requirements without a clear overarching international standard. The CEBS exam focuses on practical application of knowledge, and this question tests the ability to identify the most appropriate risk assessment methodology in a multi-jurisdictional context. Careful judgment is required to select an approach that is both comprehensive and adaptable to diverse regulatory landscapes. The correct approach involves a systematic, country-by-country analysis of relevant healthcare regulations. This is the most appropriate professional practice because it acknowledges that healthcare laws are inherently national and vary significantly. By dissecting each jurisdiction individually, the benefits manager can identify specific compliance obligations, potential risks, and necessary mitigation strategies tailored to each country's unique legal framework. This granular approach ensures that no critical regulatory requirement is overlooked and that the company's benefits programs are compliant in every operating region. This aligns with the ethical duty of care to employees and the legal obligation to adhere to local laws. An approach that relies solely on a global benefits policy without country-specific validation is professionally unacceptable. This fails to account for the diverse and often conflicting healthcare regulations across different nations, leading to potential non-compliance and significant legal and financial penalties. It also risks providing inadequate or inappropriate benefits to employees in certain regions, violating the principle of equitable treatment and potentially breaching local employment laws. Another incorrect approach is to assume that regulations in one developed country are representative of all others. This is a flawed assumption that ignores the unique legislative histories and priorities of each nation. Healthcare systems and their regulatory oversight are deeply embedded in national socio-economic and political contexts, making such generalizations dangerous and likely to result in compliance gaps. Finally, focusing only on the cost-effectiveness of benefits without a thorough regulatory review is a critical failure. While cost management is important, it must be secondary to legal compliance and the provision of appropriate benefits. Prioritizing cost over regulatory adherence can lead to severe penalties, reputational damage, and a breakdown of trust with employees and regulatory bodies. Professionals should approach such situations by first identifying all countries where the organization operates and has employees. For each country, they must then research and understand the specific healthcare regulations, including mandates, reporting requirements, and provider network rules. This information should be used to assess risks and develop a compliance strategy that is localized and effective. Regular review and updates are essential as regulations evolve. Question 16. During the evaluation of a company's retirement benefit plan, what is the most appropriate approach to ensure compliance with vesting and portability regulations while also promoting employee financial security? Option A. Design a vesting schedule that meets the statutory minimum requirements and clearly communicate the process for rolling over vested benefits to an IRA or a new employer's plan. Option B. Restrict the portability of vested benefits to only allow transfers to company-approved financial institutions. Option C. Provide employees with a general overview of vesting and portability without detailing specific rights or procedures. Option D. Implement a vesting schedule with a longer duration than legally required to incentivize longer employee tenure. The correct answer is A. Design a vesting schedule that meets the statutory minimum requirements and clearly communicate the process for rolling over vested benefits to an IRA or a new employer's plan. Explanation: this scenario is professionally challenging because it requires balancing the employer's desire for workforce retention with the employee's fundamental right to accrued retirement benefits. Navigating the complexities of vesting schedules and portability regulations demands a thorough understanding of the applicable legal framework to ensure compliance and uphold ethical obligations to employees. The core tension lies in designing benefit plans that are both attractive to potential employees and compliant with legal mandates regarding when employees gain ownership of their employer contributions and how those benefits can be transferred. The correct approach involves designing a retirement plan with a vesting schedule that adheres to the minimum legal requirements for the relevant jurisdiction, ensuring that employees gain non-forfeitable rights to employer contributions within the statutory timeframe. Furthermore, it necessitates understanding and facilitating the portability of these vested benefits, typically through options like rollovers to individual retirement accounts or to a new employer's plan, as permitted by law. This approach is ethically sound and legally compliant because it respects employees' earned benefits and provides them with the flexibility to manage their retirement savings, aligning with the principles of fairness and employee welfare inherent in benefit management. An incorrect approach would be to implement a vesting schedule that exceeds the statutory maximum period allowed by law, thereby delaying or preventing employees from gaining ownership of their employer contributions. This is a regulatory failure, as it directly contravenes the minimum vesting standards set by legislation. Another incorrect approach would be to impose unreasonable restrictions or fees on the portability of vested benefits, making it practically difficult or financially prohibitive for employees to transfer their savings. This constitutes an ethical failure by undermining the purpose of retirement savings and potentially penalizing employees for changing employment. It could also be a regulatory violation if specific portability rights are mandated. A third incorrect approach would be to misinform employees about their vesting status or portability options, leading them to believe they have fewer rights than they legally possess. This is both an ethical and potential regulatory failure, as it involves a lack of transparency and could lead to employees forfeiting benefits they are entitled to. Professionals should approach such situations by first identifying the specific jurisdiction governing the benefit plan. They must then consult the relevant legislation and regulatory guidance to understand the minimum vesting requirements and portability provisions. A best practice is to design plans that meet or exceed these minimums, prioritizing employee rights and transparency. When faced with design choices, professionals should always err on the side of greater employee protection and clarity, ensuring that all communication regarding benefits is accurate and comprehensive. Regular review of plan documents and legal updates is crucial to maintain compliance and ethical standards. Question 17. Process analysis reveals that a key employee of a multinational corporation is being transferred from their home country, which has a comprehensive social security system, to a host country with a similar system. The company wishes to ensure the employee's social security contributions and benefit entitlements are managed seamlessly during this international assignment. Considering the potential for complex interactions between national social security schemes, what is the most appropriate initial step to ensure compliance and employee welfare? Option A. Advise the employee to continue contributing to their home country's social security system and disregard the host country's requirements. Option B. Immediately enroll the employee in the host country's social security system, assuming it will supersede their home country's coverage. Option C. Research and analyze any existing bilateral social security agreement between the home and host countries to determine the applicable social security legislation and contribution obligations. Option D. Rely solely on the employer's internal global mobility policy to dictate the employee's social security arrangements, without external legal consultation. The correct answer is B. Immediately enroll the employee in the host country's social security system, assuming it will supersede their home country's coverage. Explanation. This scenario presents a professional challenge due to the inherent complexities of navigating international social security systems, particularly when an employee transitions between countries. The CEBS Global Benefits Management exam emphasizes understanding how different national systems interact and impact employee benefits. The core challenge lies in ensuring compliance with the social security regulations of both the home and host countries, while also maintaining the employee's social security coverage and entitlements without unintended gaps or duplications. This requires a nuanced understanding of bilateral social security agreements and the specific provisions of each country's legislation. The correct approach involves a thorough analysis of the bilateral social security agreement between the employee's home country and the host country. This agreement will dictate which country's social security system the employee remains subject to during their assignment, thereby determining contribution obligations and eligibility for benefits. This approach is correct because it directly addresses the legal framework governing cross-border Social Security coverage, preventing non-compliance, and ensuring the employee's rights are protected according to international agreements. It prioritizes adherence to established treaties and national laws, which is a fundamental ethical and regulatory requirement in global benefits management. An incorrect approach would be to assume the employee will automatically be covered by the host country's social security system without verifying the existence or terms of a bilateral agreement. This failure stems from a lack of due diligence and an oversimplification of international social security law. It risks leaving the employee without coverage in either system, or worse, subjecting them to contributions in both countries without the benefit of coordination. Another incorrect approach would be to solely rely on the employer's internal policies or the employee's personal preference without consulting the relevant bilateral agreements or national legislation. This is ethically problematic as it prioritizes internal convenience over legal compliance and the employee's statutory rights. It also demonstrates a failure to understand the mandatory nature of Social Security contributions and coverage in most jurisdictions. Professionals should approach such situations by first identifying the relevant jurisdictions and any existing bilateral Social Security agreements between them. They must then meticulously review the terms of these agreements to determine the applicable Social Security legislation for the employee during their international assignment. This involves understanding concepts like totalization agreements and their impact on contribution periods and benefit entitlements. A structured process of research, consultation with legal and benefits experts familiar with both jurisdictions, and clear communication with the employee is essential to ensure compliant and effective global benefits management. Question 18. The audit findings indicate that a recent amendment to the company's retirement plan, which also impacts the eligibility criteria for long-term disability and survivor benefits, was communicated only to current active employees enrolled in the retirement plan. The audit team has raised concerns about the adequacy of this communication strategy. Which of the following approaches best addresses the regulatory compliance requirements for this situation? Option A. Issue a follow-up communication only to active retirement plan participant who may be directly impacted by the changes in their future retirement accruals. Option B. Acknowledge the audit finding and plan to update the communication strategy for future amendments, but consider the current communication sufficient for this instance. Option C. Provide a summary of the changes on the company's internal employee portal and inform active employees via email that further details are available online. Option D. Immediately issue a comprehensive written notice to all current active employees, former employees with vested benefits, and all current and former beneficiaries receiving or eligible for disability and survivor benefits, detailing the specific changes and their implications. The correct answer is D. Immediately issue a comprehensive written notice to all current active employees, former employees with vested benefits, and all current and former beneficiaries receiving or eligible for disability and survivor benefits, detailing the specific changes and their implications. Explanation. This scenario is professionally challenging because it requires the benefits manager to navigate complex regulatory requirements concerning the disclosure of retirement, disability, and survivor benefits, particularly when dealing with potential plan amendments. The challenge lies in ensuring that all affected participants receive timely and accurate information in accordance with the governing regulations, while also managing the administrative burden and potential impact of such disclosures on employee morale and plan perception. Careful judgment is required to balance compliance obligations with practical implementation. The correct approach involves proactively communicating the material changes to all affected participants, including those who may be eligible for or currently receiving disability or survivor benefits, and those who are active participants in the retirement plan. This approach is right because it aligns with the regulatory requirement to provide clear, accurate, and timely notice of material modifications to employee benefit plans. Specifically, regulations typically mandate that participants receive advance written notice of any changes that could adversely affect their benefits or eligibility. This ensures transparency and allows individuals to understand how the amendments might impact their future financial security and current entitlements. Adhering to this proactive communication strategy upholds the ethical duty of care owed to plan participants and ensures compliance with disclosure mandates, preventing potential legal challenges and participant dissatisfaction, an incorrect approach that involves only informing active retirement plan participants about the changes, fails to address the broader impact on individuals receiving or eligible for disability and survivor benefits. This is a regulatory failure because these benefits are often integral parts of the overall compensation and security package, and material changes to the plan that affect them must also be communicated. Ethically, it breaches the duty of fairness and transparency to all potentially affected individuals. Another incorrect approach, which is to wait for participants to inquire about changes before providing information, is also a significant regulatory and ethical failure. This passive stance violates the spirit and letter of disclosure regulations, which require proactive notification of material changes. It places an undue burden on participants to discover changes that directly affect their financial well-being and can lead to a loss of trust and potential legal repercussions for the employer. A third incorrect approach, which is to only provide a summary of the changes on the company intranet without direct notification, is insufficient. While an intranet may serve as a repository of information, it does not guarantee that all affected individuals, including retirees or those on disability leave who may have limited access or awareness of intranet updates, will receive the notification. This approach fails to meet the regulatory standard for direct and effective communication of material benefit plan changes. The professional decision-making process for similar situations should involve a thorough understanding of the specific regulatory requirements for plan amendments and participant notifications. This includes identifying all potentially affected participant groups: active, inactive, retirees, disabled, survivors, and the nature of the benefit changes. A risk assessment should be conducted to determine what constitutes a material change requiring specific notification. The chosen communication method must be demonstrably effective in reaching all affected individuals, and a record of communication should be maintained. Consulting with legal counsel specializing in employee benefits is also a crucial step to ensure full compliance. Question 19. Comparative studies suggest that in countries with robust public healthcare systems, employers offering private health benefits should primarily focus on supplementing rather than replacing these public provisions. From a global benefits management perspective, what is the most appropriate strategic approach for an employer when designing private health insurance plans for employees residing in such jurisdictions? Option A. Focus solely on providing access to private healthcare providers, regardless of the existing public healthcare infrastructure and its coverage. Option B. Prioritize private health insurance plans that offer comprehensive coverage for all medical needs, effectively making the public system redundant for employees. Option C. Implement private health insurance plans that mirror the coverage of the public system to avoid duplication and reduce overall benefit costs. Option D. Design private health insurance plans to cover services that are not fully provided or are subject to long waiting times within the public healthcare system, ensuring compliance with local mandates. Correct answer is D. Design private health insurance plans to cover services that are not fully provided or are subject to long waiting times within the public healthcare system, ensuring compliance with local mandates. Explanation. This scenario is professionally challenging because it requires a benefits manager to navigate the complex interplay between employer-sponsored benefits and national healthcare systems, particularly when considering global workforce mobility. The CEBS designation emphasizes a comprehensive understanding of benefit plan design and administration within various regulatory environments. A key challenge lies in ensuring that employees receive adequate healthcare coverage regardless of their location, while also managing costs and complying with diverse legal frameworks. Careful judgment is required to balance employee well-being with organizational objectives and regulatory mandates. The correct approach involves a thorough understanding of the specific public healthcare provisions available in each country where the company operates and for its globally mobile employees. This includes recognizing that in many countries, the public healthcare system serves as a foundational safety net, and employer-sponsored private benefits are often designed to supplement, enhance, or provide access to services not fully covered by the public system, or to offer faster access to care. Regulatory frameworks, such as those governing Social Security contributions and mandatory health insurance, dictate the minimum level of coverage and the employer's role. Ethical considerations demand that employees are not disadvantaged by their employment status or location, and that benefits are administered equitably and transparently. An incorrect approach would be to assume that employer-sponsored private health insurance is always a complete substitute for public health care. This fails to acknowledge the legal and social obligations in many jurisdictions where public health care is a fundamental right or a mandatory provision. Such an assumption could lead to employees being underinsured or facing significant out-of-pocket expenses if the private plan does not adequately cover essential services, or if there are gaps in coverage due to the absence of a robust public system. Another incorrect approach would be to solely focus on cost containment without considering the adequacy of coverage and compliance with local regulations. This could result in a benefits package that is non-compliant, leading to legal penalties and reputational damage, and failing to meet the fundamental needs of employees. A third incorrect approach would be to apply a one-size-fits-all benefit strategy across all countries, ignoring the distinct characteristics of public versus private healthcare models and the specific legal requirements of each jurisdiction. This would likely lead to either overprovision of benefits in some regions, increasing costs unnecessarily, or underprovision in others, creating compliance issues and employee dissatisfaction. Professional decision-making in such situations requires a systematic process. First, identify the specific countries of operation and the location of globally mobile employees. Second, research and understand the prevailing healthcare model in each jurisdiction, distinguishing between universal public systems, mandatory social insurance schemes, and predominantly private insurance markets. Third, analyze the legal and regulatory requirements for employers regarding healthcare provision in each country. Fourth, assess the role and scope of the public healthcare system and identify potential gaps or areas where employer-sponsored benefits can add value or provide necessary enhancements. Fifth, design or adapt benefit plans to complement, rather than solely replace, public provisions, ensuring compliance, adequacy of coverage, and cost-effectiveness, while prioritizing employee well-being and equity. Question 20. Operational review demonstrates that the current claims processing and payment system for a multinational employer's employee benefits plan is outdated, inefficient, and poses potential data security risks. The employer is considering upgrading to a new system and is evaluating two primary approaches: one that offers significant cost savings through automation and streamlined workflows, but has limited transparency into its underlying data handling protocols, and another that is more expensive but provides comprehensive audit trails, robust data encryption, and clear adherence to international data privacy standards. Which approach best aligns with the principles of responsible global benefits management, considering the need for regulatory compliance and member protection? Option A. Opt for the system with the most advanced automation capabilities, deferring any necessary compliance upgrades to a later phase once the system is fully operational. Option B. Select the system that offers significant cost savings through automation and streamlined workflows, assuming that vendor assurances regarding data handling are sufficient. Option C. Prioritize the system that offers comprehensive audit trails, robust data encryption, and clear adherence to international data privacy standards, even if it incurs higher initial costs. Option D. Implement a hybrid system that combines elements of both approaches, focusing on the most cost-effective automated features, while outsourcing sensitive data processing to a third party with minimal oversight. The correct answer is C. Prioritize the system that offers comprehensive audit trails, robust data encryption, and clear adherence to international data privacy standards, even if it incurs higher initial costs. Explanation: this scenario presents a professional challenge because it requires a benefits manager to evaluate and select a claims processing and payment system that not only meets operational efficiency goals, but also adheres to stringent regulatory requirements and ethical obligations concerning data privacy and member rights. The complexity arises from balancing technological capabilities with legal mandates and ensuring fair and timely benefit adjudication. The correct approach involves selecting a system that demonstrably prioritizes data security, privacy, and compliance with all applicable regulations, such as those governing health information and financial transactions. This includes features for accurate and timely payment processing, robust audit trails, and mechanisms for dispute resolution that align with regulatory expectations for fair claims handling. Such a system ensures that member benefits are administered impartially and in accordance with legal frameworks, thereby upholding ethical standards and minimizing legal risk. An incorrect approach that focuses solely on cost reduction without adequate consideration for regulatory compliance risks significant legal and ethical breaches. For instance, a system that offers lower upfront costs but lacks robust data encryption or fails to meet audit trail requirements would violate data protection laws and potentially lead to penalties. Similarly, an approach that prioritizes speed of processing over accuracy and fairness in claims adjudication could lead to wrongful denials or overpayments, contravening regulations designed to protect member entitlements and ensure equitable treatment. Another incorrect approach might be to select a system based on vendor reputation alone, without a thorough due diligence process to verify its compliance with specific jurisdictional requirements and its ability to handle the complexities of the benefits offered. This oversight could result in a system that is not fit for purpose from a regulatory standpoint. Professional decision-making in such situations requires a systematic evaluation process. This involves clearly defining the regulatory landscape, identifying key compliance requirements related to claims processing and payment, and assessing how each potential system addresses these mandates. A thorough risk assessment, considering both operational and compliance risks, is crucial. Furthermore, engaging legal and compliance experts during the evaluation phase ensures that all regulatory nuances are considered, leading to a selection that is both operationally sound and legally defensible.